Welcome to the 2023 Vermont Statewide Emergency Medical Services Protocols Update Introduction. We are pleased to present protocols that we believe are progressive, evidence-based whenever possible, and will promote excellence in patient care. A brief overview of the protocol development process. Over the last 2 years, we have worked hard to collect feedback and suggestions for protocol updates from a wide span of our EMS community and other stakeholders. Each month, we held a regional meeting in different districts of the state and devoted time to discuss protocols. Many good ideas came out of these meetings. We also had the opportunity to meet with the district medical advisors several times throughout the year and greatly value their input. Once again this year, we convened a protocol work group composed of your peers, paramedics, AEMTs, and EMTs, who met on a monthly basis and did an outstanding job in digging deep into the protocols and making very thoughtful suggestions for revisions. We were pleased at how well this group performed and that EMS has a strong voice at the table in the development of your own protocols. Many thanks to the protocol work group for their excellent work. We use many resources for our protocol update, including the National Model EMS Clinical Guidelines. The Clinical Guidelines project was first initiated by NASEMSO in 2012 and has produced 2 versions of model clinical guidelines for EMS, the first in 2014 and the most recent version in August 2021. The guidelines were created as a resource to be used or adapted for use on a state, regional, or local level to enhance pre-hospital patient care. Another key resource we used is the 2019 update to the National EMS Scope of Practice Model. Vermont is a national EMS Scope of Practice state. The National EMS Scope of Practice Model is a guide for states in developing their scope of practice legislation, rules, and regulation. The practice model is a consensus document, guided by data and expert opinion, that reflects the skills representing the minimum competencies of the levels of EMS personnel. The practice model has been utilized by states as a means to increase uniformity in EMS for over a decade and by Vermont since 2013. The practice model establishes a framework that ultimately determines the range of skills and roles that an individual possessing a state EMS license is authorized to do on a given day in a given EMS system. It is based on the notion that education, certification, licensure, and credentialing represent 4 separate but related activities. For every individual, these 4 domains are of slightly different relative sizes. An individual may only perform a skill or role for which that person is educated, certified, licensed, and credentialed. Education is the initial training program and ongoing continuing education. Certification is the exam. The state issues a license. Credentialing, or skills verification, occurs at the EMS agency and district the provider is affiliated with and must be signed off by the district medical director, or in our system, the district medical advisor. For example, an EMS practitioner may be educated in a given procedure, but unless they are also certified, licensed, and credentialed for the procedure, it would not be within their scope of practice. In Vermont, we strive to follow the National EMS Scope of Practice model. Sometimes we will approve scope expansions beyond what is included in these guidelines if we believe there is a compelling reason that such an expansion in scope will lead to better patient outcomes in our Vermont EMS system. If we do make a scope revision, we must be able to answer 2 questions. 1, is there evidence that the procedure or skill is beneficial to public health? And 2, is there evidence that the procedure or skill can be done safely? The answer has to be yes to both of these questions in order for an expansion of scope to be included in the Vermont EMS protocols. In addition to reviewing the 2019 National EMS Scope of Practice Model, the Vermont EMS Protocol Workgroup, DMAs, and participants at the regional protocol meetings examined all of our existing protocols in great detail, combined with a review of the most recently published EMS literature to make additional recommendations for revisions. All the significant protocol changes we have made are shown in an executive summary document. The protocol name, practitioner level affected, actual text that was changed, and explanatory comments when needed are shown for each protocol update. This document is attached to this presentation. It is recommended that you sit down with the new protocols and review the changes summarized in the document one by one. Please take some time after this presentation as an individual or as a group to complete this review. The next modules will go over specific 2023 updates to the Vermont statewide EMS protocols. The modules highlight the important changes. After you review each module, please sit down with the protocols and really study them so you know the changes well. This concludes the 2023 Vermont Statewide EMS Protocols Update Introduction.